side again, more of this right, lateral scalene area. Okay, and I use muscles more so as landmarks than as targets of treatment nowadays. So palpating from medial towards anterior scalene SCM area. Oh yeah, we can find some stuff there. And come a little further down here. Oh yeah, she's got all kinds of interesting stuff there. And then we come a little further forward. Not so bad there.
So when you say interesting, is that what you're feeling under your hands, or is that based on what her facial expression is
A
saying?
little bit of both.
Okay.
So for example, like I used to think in terms of like, oh, that feels ropey, that feels knotted, that feels, I had all these adjectives for what the tissues were.
Yeah.
But we know muscles can't actually tie themselves in knots.
Right.
So, ropey, we know it's not actually a rope, but it kind of has that thickened cable-like feel to it sometimes. So, I try not to use that language with my clients now because, again, that can give them a totally wrong impression of what's actually going on in their tissues. So, so I'm just like, oh, a little grumpy over there.
Yeah.
Okay. Is that technical to call it grumpy?
No, but it's relatable.
Yeah.
Mm-hmm.
Yeah.
And it doesn't create a fear.
Yeah, it feels a little pissed off. So okay, I'm going to be nice to it.
Yeah.
Because if somebody's grumpy, usually they'll calm down and feel better if you're a little nice.
Mm-hmm.
Okay, so I found a grumpy spot over here. So this hand right here, now I'm just going to cradle her neck, and then I'm going to try that balloon technique. Okay, and so what does it look like I'm doing? What's it feel like to her? Feels like I'm just holding her head and neck nice and supported. And then I'm very gently, with the palm of my hand, I'm just going to palm some of the skin of her neck. It's not going to feel to her like I'm doing much of anything. Oh, let's find our grumpy spot again.
Right there. It's all sore, right?
There it
That's
is. That's the one. Okay. It hurts less when you smile. Okay. So, what does it feel like I'm doing right now?
It feels like you're just kind of cupping the skin and pulling it away a little bit.
Yep. Most people would say nothing. Nothing. You know what I'm doing. But here's the thing. So she knows what I'm doing, and yet it still doesn't feel like I'm doing all that much, right? Very few people are going to be like, oh, it feels like you're cupping the skin and pulling it away. No, most people are going to feel like, it doesn't feel like you're doing much, or like it just feels like you're holding my neck. When I press here now, how does that feel?
Doesn't hurt.
Oh. See, now that's a frown of confusion, not of pain. So, as we go along this weekend, we'll get more into the mechanisms and some of the anatomy behind what we're doing and why these you notice certain things. Okay, but notice it again. Took a few seconds, but then the thing is to just pause, to not do a whole bunch more stuff, to give her body time to do the stuff it needs to do without getting in the way. And so I am trying to do the absolute bare minimum in order to get a positive response. Okay, this is where we get into dosing. How much pressure and speed and all that stuff do I need to use? I'm looking for what is the minimum effective dose of touch, pressure, of pulling, of positioning, of all that stuff. Okay, how hard am I working physically?
Laboriously.
I can do this all day, and my hands don't even get tired. Okay. No, sometimes I'll feel an obvious softening or warming or some other positive, what seems like a positive change there. Does that mean it actually feels better? No, not always. Sometimes I don't feel a physical change where I'm palpating at all. Does that mean it doesn't feel better? It's all about her. So, and Jane turned her thing upside down. Is that so I could still read it?
Nope, that's why I
Okay,
put
you
it
know
on
what?
without my
That's
glasses
perfect.
on.
I would say just leave it just like that. That's perfect. All right. So when I'm pressing here now, Jane, how does that feel?
Absolutely no pain whatsoever.
Cool. Okay.